With health equity zones, the Rhode Island Department of Health, and all across Rhode Island, we believe strongly that everyone deserves the opportunity to live a healthy life regardless of their zip code. The Health Equity Zones is not just a project, it's really a movement. We know we have socioeconomic and environmental conditions that need to be addressed. We know about the disparities, we know about the numbers that exist. Health Equity Zones gives us an opportunity to go from talking about those numbers to putting an infrastructure in place that puts the community's voice front and center and gives us the opportunity to do something about those numbers.
Particularly in communities here like Olneyville, where we're part of the HEZ, we know that living in poverty is a toxic stressor which can negatively impact brain development. We know that with a mindfulness program as part of social and emotional learning, we can teach them healthy coping strategies for success in school and life.
The impact is seen daily. We have a walking school bus. If you live less than a mile away, 0.9, 0.8, you have to walk to school on your own. When you're 5, 6, 7 years old, it can be a little scary. The walking school bus ushers them to school safely and brings them home safely.
Thank you. Oh, yeah. 120. The great thing about Sankofa World Market actually is, especially in the West End and the South Side community, there's not a lot of grocery stores that provide these fresh foods. So the goal of the market is to have the chance to provide fresh produce, and we also provide a lot of nutrition to those in the community that may not have access to it.
Hi, my name is Alicia and I went through the Youth Police Initiative. It was important because I felt like I was more safe in Providence now that I got to understand where the police were coming from, and I feel like the police got to understand where we were coming from. Yes, I see them patrolling around and they always wave to me.
It's important to have healthy, clean, quality, affordable housing, because if people don't have a home to go to and they don't have a place where they can focus in, they can't thrive. They can't perform at work, they can't perform at school, they can't think about progress because they're too busy surviving. We've addressed the housing by forming Neighbors for Revitalization, bringing community members out to get engaged in their lives, in the course of their lives, and what happens with housing in their neighborhoods.
I really appreciate the work of our HEZ groups. I think that as a mayor, their voices really help instill the fact that there are many concerns that sometimes we don't see, that we might overlook, and one of them is their health. And I think that this ordinance will help control the runoff by planting more trees. It will help clean the air, and more importantly, for those who like to exercise, walk the streets, there'll be safety for them to do so. The Green and Complete Streets was an exciting initiative for Central Falls, and we were happy to get behind it. The principal message behind this ordinance now is that we're going to look towards the future and make our investments that will help serve all of our residents. So I really have to appreciate everyone who was involved in the HEZ, but more importantly, our community residents who really got involved and spoke out about these matters.
It was an amazing process. Ours was unique for Newport because it was community-centered. We had meetings that were informational, we had workshops, and then the draft that we came up with for the ordinance we presented to the experts in that industry so that we can get fine-tuning and see what things we needed to improve on. And now it's with our city council getting revised.
We're creating spaces to let residents come and be able to contribute what they have, their talents, their gifts. You know, everyone in the community has something to give back. And we are here to create those spaces in order for them to invest into the community they live in.
Bristol let us know about how they felt there weren't enough services in mental health. So our group formed a working group, the Substance Abuse Awareness and Prevention Working Group, and we met to discuss the needs. And at that time, much of the funding was going to prevention programs in the school district, but they weren't going to address the needs of the adult in our communities.
In both of the communities where we facilitate the HEZ, the opioid crisis has been pretty devastating. In Woonsocket, at least in 2016, there was the highest rate of death as a result of opioid overdose in the state, almost twice the state average. West Warwick has been, among the top hardest hit communities as well. So it was really important to us and to the community to focus on this issue. In 2015, Governor Raimondo also launched the task force to prevent overdose and rolled out the strategic plan to reduce overdoses and save lives. In our HEZs in both West Warwick and in Woonsocket, we made the decision to implement on a hyper-local level.
It's what you're doing together here that makes this so special. And this is a really important SAMHSA grant, and one that I hope will become a model around the country.
The collaboration that we fostered through our Health Equity Zone was critical to us being able to receive this grant. We've got 2 hospitals, 4 health centers, our community mental health center, all collaborating on this effort. Zero Suicide is an initiative that is done typically in one health system. And what we're doing is taking a population health approach.
Policies are changing, outcomes are changing. Health Equity Zone residents and members are starting to run for offices and become elected officials. That's how Health Equity Zones is making a difference, and that's going to positively impact everyone across the state.
The HEZ has been amazing for our community, not just in our school. It's had a tremendous impact already over the last year or 2. It's provided a voice for our families, and it allows them to believe that others know about them and care about them. It's amazing that an organization, multiple organizations have come forward to provide that for our families. That sense of confidence that others are looking out for us, they believe in us, allows our families to give more and more to our school, to their community, and it makes a tremendous difference.